So Dr. Wong is an international expert on Hansen's disease. He has done a lot of the organizing in the U.S. around culturally competent healthcare. He is the director of Kaiser's Medical Benefit, their foundation arm that they have going on, the medical director of that. I think you guys saw in the invitation that something he should be more proud of. San Francisco Chronicle named him Father of the Year several years back. He has been a physician in a community health center in Oakland, California from, well, actually I just found out that he was a student in there before he was a physician working in that health center. He was the medical director of Region 9, working for the Public Health Service for a while. And I happen to know because I was on some committee meetings with the National Association of Community Health Centers when there was, several years ago, discussions about who should be the next Surgeon General, that he was one of the top names being considered for Surgeon General. He's a real leader in our nation. He's steadfastly committed with his whole life to the underserved. He's a community health center doctor, and he's a good friend of mine. Let's welcome Winston Wong.
Thanks, Gary. Thank you for being so gracious, so generous, and I'm not a hero, I'm a fan, right? And it's even year for the Giants, so it's always good to be here. And it's always good to see everybody enjoy their pizza. It is not going to be do you have my PowerPoint, Gary? There's no PowerPoint. There's no PowerPoint. Okay, there's no PowerPoint. I gave him a surge of kind of anxiety there. There's no PowerPoint, and it probably even more for you guys, the surge of anxiety, you can be alleviated of that, because this is not about me kind of giving you a lecture. It's really about me having a conversation with you. So all of you, be alert. I am not a shy person when it comes to really having you participate in this discussion, because we have about maybe 45 minutes or so to really explore some of the issues that you're just starting to get immersed in. And as I understand, you're nearing the end of your first year. You've been embedded in biochemistry and physiology, anatomy, supposedly all the good things about being a physician or a physician assistant or a dentist, as I understand. Well, actually what I wanted to do, and how many of you have heard me talk before offhand? So forgive me. but some of the themes that I'll touch upon are kind of consistent through the years. I try to build on them, though. And we live in interesting times. I can't help but build upon it. So actually, here you are eating pizza here in Mesa, Arizona, or Arizona, Phoenix area. And I was just thinking how you remember why you're here, right? And it always reminds me of when I first learned that I got accepted to medical school, okay? Because, God, dare say it's about 35 years ago. But I do know how it was such a special day for me. And so I want you just to think now, in between your bites of pizza, do you remember when you opened up, I guess these days it's not paper mail, it's your email, with regards to getting accepted to the AT Still School of Medicine? I want you to just think about that for 20 or 30 seconds. Go back to that period. Because sometimes when you're in the midst of physiology and anatomy, biochemistry, it's like, God, this is what I asked for? Right? So just think about it for just a few seconds. Now, I can't resist, okay, because this lady is chuckling at that thought. So I'd like you to share. Are you one of the students here? Okay. Never know, you could be faculty. Why do you chuckle about that? What do you remember about that day? Oh,
I can
bring
use
my-
this one.
Okay, use that one, yeah.
I remember getting the phone call after being told it was 2 weeks, and it was 2 days, and I dropped the phone, and I ran out the door, and my roommate was so confused, and I was so excited for so many months, and I think that being now like almost 9 months in, sometimes it's a little bit more dread to come back to school after spring break. I think we're all feeling that, but you go back to that moment and you have to like think about how exciting it was, and you're just in one step of this journey.
Yeah, so it was kind of like elation, I guess, right? Did someone else have an experience about when you first opened up your envelope and what you felt about getting accepted to this esteemed institution? Someone over here. Tell you can't be complacent here.
I got a call too.
Oh, please share with your
No,
classmates.
it's fine.
You got a call. No, I think you might be on camera, believe it or not.
Oh, okay.
So
Can you hear me? Do I have to push the button? Oh, there you go.
there you go.
Yeah, I got a call, and I asked Dr. Bordenov was my caller. I'm a PT student, and I asked her, really, that was my first word. I asked her if she was serious. So,
So it's really interesting. There's almost like, I can't believe that I got accepted, right? And there's this whole aura of, God, my life will change because something I've really worked for and dreamed for is coming to be true.
yeah, I got a call, and I was a 9th grade math teacher, and I got a call in
Oh,
my
wow.
classroom.
Wow, that would have been amazing. So your teachers, or your students said, there's no homework tonight, right?
No.
Did your students know that you got accepted?
Yeah, one of them just texted me yesterday saying she's going to PT right now.
Oh,
So,
God, that's
yeah.
so inspiring. Well, congratulations. That's a great story. One more story. I can tell you, one of your fellow students from previous years told me a really great story. Who else had an experience about opening up that envelope that you want to share? This looks like non-students. I don't want to be disrespectful. These are non-students. How about over here? One of you. Tell me what happened when you opened up your envelope. Yeah. Your meal will be served soon. Don't worry about it.
So I was working in like a clinic in Houston, and I just came back from Arizona for my interview, and I was working like a night shift, so it was like probably around like 8:30, 9 p.m. And I got a phone call, and it was interesting because they said, oh, is this Ashwin Shankar, And I said yes, and they said, oh, you got accepted, and I said, are you sure?
There's a lot of self-doubt.
And then my next question was, are you really sure?
Oh, wow.
And yeah, it was just incredible. It was like all this work you put in.
Yeah.
You finally have like an end result in terms of like you have like a kind of like a career. Like you have like a path you can actually go on.
Kind of have a career, yeah.
But yeah, it was really nice, and like my mentor, my other people in the clinic, like they let me take the night off. It was really.
What did you do?
I worked at a sports nutrition clinic.
Oh, and you had to do a night shift.
Yeah, I was like collecting data and stuff, so it was kind of like a 24-hour lab reading thing, and so I was just there, just going at it, and then it was just crazy because I honestly expected it was like an email or it would be like a few weeks, but I interviewed, I think it was on a Friday or Saturday, and I think on Monday or Tuesday I got the call.
Well, congratulations. It's a great story. Now, and everybody should know, you should go to Shaker, to talk about sports nutrition, right? So, you had a classmate a few years ago. I thought it was a really funny story. She was a mother, and then she told me that when she got her acceptance letter, her like 6-year-old son got so excited he took his clothes off and was jumping around naked in his house. Did you remember that story, Gary? That was really funny. God, it just reminds me of my experience in terms of, God, I was floating on clouds for so long, right? And it's really hard to kind of get your head around the fact that you're going to be a doctor and how this was a dream of yours, that you really built upon all those hours that you studied and didn't go to the movies or didn't go to the ski trip and didn't do things with your friends because you were committed towards this goal. So congratulations. But see, something happens over the course of becoming trained as a health professional that all that elation and just that fantastic feeling somehow at a time if your training starts to really get squelched. And AT still is probably among the best institutions that doesn't do that, but there will be times when you kind of will say, gee, what happened? Where was my thrill? Where's my thrill gone with regards to being part of this profession? Now think about it. Why do we call this a profession, and why was it so important that you got accepted to this school and what your career is? Now, this is what I want to ask you. And it's something that I really want you to take away with yourself when you start, quote, seeing patients and taking care of people. Why do people want to come and even see you? Why do people want to connect to you as a physical therapist, as a physician assistant, as a physician, as a dentist? At the core, why do people want to see you? Can you think about that? So I'm going to go around, I'm going to ask someone, why do people come to see you? And you can tell me what you're getting trained and going to school for.
Okay. My name is Hans. I'm part of the SOMA program, and I guess they come to you because they trust that you can make them feel better.
Okay. When you say feel better, let's explore that a little bit. Do you go see a doctor sometimes?
Mm-hmm. Yeah.
Okay. Why do you go see them?
Because something is wrong physically, and I go there so they can...
Okay, but there are times where there's something wrong physically. You don't go see a doctor, right?
Yeah, so when it's out of my control and I feel like I need help.
Okay, so let's get a little bit into the real reasons why people go see a healer as opposed to a doctor, right? You said it's because something doesn't feel right or wrong, right? Mm-hmm. Okay, now give me an example of when you did that, if you can, if you don't mind. What was wrong?
I sprained my ankle pretty bad, and I wasn't sure if it was broken or not.
Okay, so what were you really concerned about? That you wanted to get it checked out because you were afraid of the diagnosis, or were you really trying to seek something else? Were you walking?
I was limping.
Okay, okay. Had you had that kind of injury before?
No, that was the first time.
Okay, so my point is being, if you really distill down why people go see a doctor as opposed to looking up what might be wrong on the internet, WebMD, right? We all looked at WebMD. It's like, did you look at WebMD when you got your ankle sprained or whatever? So you already looked in it. So why did you go see this doctor?
I trusted them more than WebMD.
Okay, so that's a good point too. So at the singularity of the emotion with regards to why a person seeks to see a doctor or healer is in your case sounds like mainly a question of security, in that you wanted to have some security with regards to whether something serious was wrong. Is that right? Okay. So that's one aspect. Just think about that. Why do people see you? And what are they seeking? They're seeking security, for one. What else are they seeking? Someone at this table. Take a shot at it. You're going to be doing this for the rest of your life. Why do they see you? Why do they see you as opposed to looking at WebMD? Try it. No wrong answers.
I guess because at the core of it, they really feel that you're the one that'll improve their health. So, like, rather than just going through the motions of seeing a doctor and having that official, oh, I've had my obligatory visit, and but the reason they would kind of see you particularly would be they think that you're the one that can make a real difference.
Okay, so let me distill it down to a human emotion here. We're still thinking a little bit up in our cerebral cortex here. Okay. Actually, what people worry about, they worry that something might go wrong, right? This creates anxiety. So, to our colleague here who talked about security, worry and security are very closely matched in terms of what distills down to why people want to seek a healer. Before there were physicians, there were healers, right? There were healers in every community, in every neighborhood or village or whatever, and they were worried about something. But you're missing one other reason why people go see a healer. How about someone at this table?
I was thinking like just the human connection in general and just being able to communicate with the person versus like what you were saying with like WebMD or something. Like you can get your questions answered right there and then and actually talk it through with someone and have that person be there for you and like be your confidant, talk to them. So.
Okay, so you think being a healer involves kind of the human interaction. You've seen a doctor before, I assume. Did you go see your physician because you want the human interaction?
Well, I mean, part of it in terms of like questions I had or concerns I had, sometimes like if I went to like a general physician, like I had one problem but I also wanted to discuss something else, or I wanted to find out more about what is actually going on.
Let me ask you this way. We all have friends and relatives who, they often say, I hate seeing doctors, right? Everyone has a friend or relative that says, I hate seeing doctors. When do these people ever see a doctor? When do these people ever see a doctor?
When their wife makes them go.
When their wife makes them go. That's a sexist comment, right? Why would someone say, I'd never see a doctor, but I'll see the doctor now? Ted, we talked. Why?
When they're bleeding, or
Yeah.
or I guess
Loss of limb, huh?
yeah, lots of blood. Or I guess my cousin, she's kind of anti-vaccine,
Yes.
but her she lives in Los Angeles, and Los Angeles requires your children to be vaccinated. So
Okay.
that's the only time that she did
That's an interesting thing. Legal compliance issues, I guess you can call it. Well, my thing is, you know, really at the base of it, why many of us, or all of us, will probably eventually go see a physician, healer, physician assistant, is because we're in pain, right? Now, sometimes it is physiologic pain. The pain receptors are firing, and I got to get some relief. Actually, my son wouldn't like me to tell you this, but last week he came back from some partying, and then he said, oh, my stomach really hurts. You know, he was almost ready to see the doctor. But people come to you because of pain as well. And sometimes that pain is physiologic. Arguably, at least half the time, it's psychological, right? They seek relief from the pain of having to deal with worry, insecurities, isolation, to your point. So what do you do in medical school? Do you learn about how to care about people in pain? Do you learn about people who are worried and have anxiety? What do you really learn? You're learning a book of knowledge, supposedly, that provides you with a diploma that says you have a certain skill set that is encyclopedic with regards to anatomy, biochemistry, physiology. But that is really far between what we think is at the essence of being a healer, right? As opposed to being a doctor. So think about that, because I want you to connect why you felt so thrilled to get your letter of acceptance and what really is thrilling you. Was it so thrilling to say, I'm going to be a walking encyclopedia about the human body? People chuckle about that. That's good. Or were you so thrilled about the opportunity to provide a healing relationship to people that's based upon recognizing that people come in with pain, people come in with insecurities, people come in with worry. Now, the other question I have then is, when you think about the unique role that you're getting trained as a physician, think about these components of what you bring to the table. And you actually have interactions with people that have these components that are not named doctors. Okay, so think about it. Who would you think embodies some elements of the things we talked about in terms of addressing anxiety, worry, and pain? Yes, please. Oh, that's great. I really like that answer. My wife would like that answer. Because mothers kind of have been nurtured or instinctually to a certain degree, and or if you have great role models about providing that comfort and security. But how about someone that gets paid? That's a profession that doesn't get paid, motherhood, per se. How about over here? What are the things what are some occupations that take into account people who are in pain, anxiety, and worried? You think about it. You see them every day. You don't? Or maybe every week.
Teachers.
Teachers. Who said that? That's like God said that. Who said that? Was it over here? Oh, great. Teachers. So your teachers, you have some great teachers that provided you that. Okay. So one thing is, a bit closer to today, since it's Good Friday, is that actually a lot of clergy do play a role, right? So when you think about people who are in pain or worried, actually sometimes, depending on their faith and depending on their religious tradition, they will go to seek some advice or comfort or counseling from a clergy person. What other person would provide kind of the dimensions of what a physician does? Do you have any thoughts here? Is it so unique that we provide this thing?
Friends.
Friends? Okay, profession. You can be a professional friend, I think. I don't know. I have to think about that one.
I would say, yeah, like a clinical therapist.
Clinical therapist, a behavioral health specialist. That's good. Let's think outside the health professions. How about over here?
God, a higher entity.
Okay. I would not call that a profession. But I know what you're saying. It provides you. Let's talk about the professions or jobs. You have friends maybe that do this stuff. Okay. Think about it. Who has a body of knowledge that is so kind of technical that you actually you have to seek information in order to navigate the process? I guess you're too young. You've never really talked to a lawyer yet. Because you think about lawyers, you think about people who are seeking help because of the technical variances of law. Even though you might have a complaint against your landlord, or you might have a complaint against the government itself, you need a lawyer who has an encyclopedic sense of knowledge in terms of how to navigate, right? So there's an aspect that is professional with regards to thinking about a body of knowledge that you actually have to provide your patient with, in terms of they love friends and they love relatives, but they're going to see you because you know what blood in the urine means, right? Okay. Now what other person do you think you touch on a regular basis that provides you an environment that understands you, that is not so emotionally involved with you, that can provide you with some amount of security and kind of getting a sense of where you're at. This one's a tough one. Is there anyone that you see regularly?
An insurance agent.
Oh, who said that? The voice of God again. Now, you said God and you said insurance agent, so I'm trying to figure out those two things.
So am I.
Yeah, go ahead. You want to elaborate on the insurance agent?
Well, yeah, so an insurance agent's going to provide you the information of what you can get and what you cannot get. So who you can see, who you can't see versus the insurance that you're provided with, the coverage that you're given.
Okay.
So, I mean, that could kind of give some reassurance or not.
Yeah, that's a good one. Yeah, do you have a
What about like a
suggestion?
mechanic? I certainly don't
Oh,
know what
mechanic.
to do. So.
Yeah, that's an interesting one. I like that one. Yeah, so you're a mechanic. Do you have a relationship with your mechanic? Not in the personal sense, but.
Yeah, actually.
Yeah, you do? Okay. That's great. He or she knows enough about your brakes that she knows about your interpersonal development. Actually, this is what I've shared with this audience before. So I think about physicians and physician assistants very uniquely. You're like a lawyer, because you have an encyclopedic sense of some aspect that's really beyond the reach of most folks who haven't got that educational background. You're clergy in that you have to think about the emotional trials and pain and the kind of security you have to provide. The other person that I really think comes into the fold, especially if you're a primary care provider, is your hairdresser and your hairstylist or your hair cutter. Now, why do I say that? That's really odd. But you know what? Now, you relate to this, right? You have a hairdresser.
Yes.
You have very nice hair. So, how often do you see your hairdresser?
Every 5 weeks.
You want to use the microphone to share? Every 5 weeks. This turn it up. Press this button here.
Okay.
Every 5 weeks.
Yes.
And how long have you seen him or her?
About 2 years.
2 years. So every 5 weeks you're seeing her. And is it a her?
Yes.
Okay. And does she ask you about things?
Oh yes, it's like going to a counselor.
Yes, it is. And why do you feel safe with this hairdresser, hairstylist?
Because she probably forgets when I leave what I told her.
Yeah, so, I mean, there's an interesting aspect to this. It's because you feel safe in that you have a relationship with her, but you feel like there's a certain level of security that is not going to be blabbered across your family and your relatives and your bigger family. Is that right?
Yeah, there's boundaries.
Yeah, there's boundaries. So just think about it. It's very unusual that we think about being a healer as a composite of being a clergy, an attorney, and dare say a hairdresser. But you think about it, I mean, I'm sitting in the chair and that person starts saying, hey, you know, Winston, what's been happening to your family, right? They always ask you that while they're doing something. And then they say, oh, you know what? You're getting some white hair. You've been worrying too much. You know? And so I just want you to think that there's a relationship built into the healing professions that you're going into. Now, having said that, what happens when we go into medical school? Tell me about what you've been taught now to describe a interaction with a patient. How do you present your case? Let me ask you, how do you present a case? Have you presented yet?
Yeah.
Okay, how do you present a case?
It's very proper and kind of cold, and there's really no emotion involved in it. He's kind of.
So give me an example.
I mean, I guess if you like walk into a patient room and you notice that they were crying, you wouldn't mention in your case that you held their hand or that you.
Okay, let's do row type right now. I'm your faculty. You are my student physician. Are you starting to, you're a physician? Okay. Give me a case.
Yesterday.
Don't worry, I'm not judging the.
Okay. I'm just trying to think of one.
Yeah.
Okay, so 38-year-old Mrs. Jones presents with left-sided flank pain for 1 day duration, sudden onset. She noticed blood in her urine.
Great. You did a textbook. And that's what's wrong. I mean, I'm saying heresy right now. Because usually what I said is, for one, a lot of times they don't even say Mrs. Torres or whatever. They'll just say, a 28-year-old female came in presenting with a complaint of dysuria and noticeable blood in the urine. That's how the story is told, right? How's this connected to anything we just talked about? We don't. So you basically, I could have said, this is a 4-month-old rat that presented with, they don't present with a complaint, but they present with, bacteria in the urine. So somehow or another, we have distanced or divorced ourselves from the humanity in which you felt that you were so thrilled to get into this school. And all the things as to why people come see you. They see you because they're worried. They see you because they have pain. They see you because they have anxiety. Think about your case. How much more would it have meant, or how much energy would have it taken for you to say, Mrs. Diaz is a 28-year-old mother who has 2 part-time jobs, who is complaining of abdominal pain that she doesn't know what the source is. She also notices that her urine has become red or bloody tinged. How much would it affect your therapeutic plan?
Not at all.
Not at all, to hear those components. I actually think it would. If you think of a 28-year-old mother, 2 part-time jobs, how many pressures does she have to deal with, and why did she come to see you? Okay, she came to see you because she has discomfort and she's worried. Okay, she has discomfort because of pain. She probably can't do her job. Probably the other thing, she's caring for 2 or 3 kids at home. She's got 2 jobs. So our therapeutic plan in talking with the person is, this is really hard, Mrs. Diaz, there's a lot of stress in your family. I could give you antibiotics, that's true. How much are these antibiotics going to cost you? How much are these antibiotics going to affect how you feel? How much are these antibiotics part of what you think is appropriate for your kind of care? So we have somehow got to the point where we have so much objectified the human relationship because we think it's in the interest of how we talk about providing medical care to a patient. So 9 times out of 10, in every setting that we have in a clinical setting in the hospital, people expect us to say a 49-year-old male presented with chest pain induced by climbing up 4 flights of stairs. We don't talk about a 49-year-old Chinese American male who immigrated 10 years ago is now having distress with chest pain whenever he walks up the stairs. And he's a part-time worker at a kitchen. It affects so much in terms of how we frame the case and how we care for people, right? So this is really important, I think, as you go into your clinical years. I ask you, don't go to the dark side, right? Where you're trying to objectify every component because it's a physiologic problem that you got as a case study as opposed to understanding the people that you're caring for because of those reasons that I mentioned, right? So, looking at the time, there's a couple of other components here. So we talked about the profession and why you got into medical school. When you got accepted to medical school, the next day did you puff up your chest a little bit and walk around like, I'm a little bit more straight now? Did you feel that way? Be honest. Okay. And I think you should feel that. You should feel pride in being part of this great tradition of being a healer. You should take pride in the fact that AT still accepted you among many qualified people. Okay? This is going to be your life. Now, the thing I would say, though, is how much did we let the title define us versus the title of being a physician assistant as being an opportunity, right? So you have to do a little bit of self-exploration because there's so much social and professional pressure for you to assume the role of being the really puffed out, very kind of proper physician because that's what's expected of you as opposed to what you are. So part of this is how do you really embrace the opportunity of being a healer, and how much is it really just being you and being part of you? Because there's going to be a time when someone's going to call you up at the hospital and say, Dr. Smith, Dr. Wong, Dr. Lee, what are you going to do? What do you expect? And you have to be able to go quickly to what it means for you as being that person responsible for that person's care. I do remember the first time I got called Dr. Wong, and it's kind of like, Dr. Wong? And I said, yeah, what, someone around here? I mean, it was, I was taking call as an intern, and they were asking me, should we increase the pain medication for this lady post-operatively? And I said, God, that's a lot of responsibility, right? So, that's one of the components, is really embracing the opportunity but not letting it define you. And along the ways in terms of how you interact with your patients. Okay, so many of us are now in the age of the electronic health record. Many of us are sitting down and say, oh, you are 28 years old and you take these medications and you're having, chest pain right now, and then type in a diagnosis. How much interaction are we really having with people? How much time is spent for us thinking of a way to exit the door rather than entering the door? That's what's going to happen. What happens a lot, especially when you're in a clinic, is how am I going to get out of this visit in order to see the next person, rather than how am I entering into this visit and thinking about how am I going to care for this person. It's a very quick transition between thinking about exiting as opposed to entering. So I really want you to think about the entering as much as you do about the exiting. The exiting is all about you. The entering is about that person. Now, how many of you also have had this relative who circles on the calendar, my visit with Dr. Wong on Thursday, April 15th, and they circle it a month ahead of time, right? And for some people, they say, I got to go to the hairdresser before, and I got to make sure that I got clean clothes on, right? In fact, maybe you have some grandparents or maybe your parents to say, Sally, I want you to make sure that on April 15th, you come here 2 hours before because I have an appointment with Dr. Wong and I want to make sure I get there. The highlight of their month, almost, is about visiting Dr. Wong because of pain, anxiety, and worry. And meanwhile, we think about, oh God, here comes Mrs. Lee, who's got her same old story, and it's Thursday at 4 p.m. How am I going to get out of this visit? As opposed to how am I going to care for this person? For you, it is a 15-minute interaction that you want to get out of. For Sally, it was a month of anticipation of what she was going to get from your relationship. It's a really different way of how you think about your interaction. The other component about this is how we think about these individuals within the context of our communities. So with your example of Mrs. Diaz, do we actually even know where she lives? Or is it just an address? Do we know if she lives in urban Phoenix? Do we know if she lives in rural Mesa or outwards? Do we know if she lives in a household with 10 people? Do we know if she lives alone? Do we know if she has the social support network? Do we know if she's on supplemental nutrition assistance program, SNAP? When we think about the individual, it's also important for us to think about this person lives with a family and lives with community. And as you construct your therapeutic plan and how you can be helpful, we have to pause and say, how much information do I have about where this person lives? So think about it. I talked about the hairdresser. The hairdresser knows about your family. She probably knows where you live. She probably knows what you're looking forward to. She probably knows what you're worried about. Because, and she doesn't think about herself as a healer, but these are important parts of how she's starting to develop that relationship with you. So, how many times do we ever ask a patient, what do you do on a typical day? I think most of us don't know what our patients who we're supposed to care for do on a typical day. We say, just present me with your problem, and I'm going to process you just like the airline attendant does when you book a ticket. Tell me what you need, I'll get you out of here. But if Mrs. Lee, Sally told you, most of the time I stay at home, I get up in the morning, everything hurts, I turn on the TV, and then I make something for myself for breakfast, and I look forward to when my grandkids come to see me once every 2 weeks. Or they might say, you know what? The day for me means I get up and rise, I take a walk for 2 hours, I go rain or shine, and it's important to me. Or she might say, every day I get up, I have to put my kids to school, I dress them, I give them a good breakfast, I'm exhausted by the time I go to work, and I know at 5 p.m. I have to do the second shift. How much do we incorporate that knowledge into what's important for our patient? So when you think about all the stuff that you're learning about renal physiology, you know, how to take care of Parkinson's, how to take care of angina, there's this big component of really what you are and what you are as a healer. Now, the last point I will make, and I know we're running against the clock here. We talked about all the things that you are going to be. And who's going to lead you through this journey? Who's going to lead you through this journey? Any guesses?
Yourself?
Part of it is your own development, but by definition, you're not alone, right? So who leads you through this journey? Is it your faculty? Is it Dr. Cloud? Yeah. Your patients. So this is what I've learned through 30-something years of caring for people. It is about your patients. Now, every patient is different. Every person on this earth is different. And you're going to meet some people that you're going to say, God, they're just like trying to seek drugs. You're going to meet some people and say, God, that person stinks. You're going to meet this person and say, God, that person's passive aggressive. It's reality. But then there's going to be people who say, that person, if I really dug into their history, I would learn really what they did for their life. Okay? So I have just a couple minutes. I'll tell you my own story. And Gary's heard this story many times, but I revisit it once a year because it's important to me. So I used to take care of an 80-something-year-old Chinese lady, Mrs. Zhang. She didn't speak a word of English. She came to the United States just a few years before I saw her. And she was one of those ladies that you might be seeing in these Chinatowns where she'd hold her kids, her grandchildren, like in a little makeshift carrier, where she'd bring her little kid back from school. I took care of her for hypertension and a little bit of arthritis. And then she told me one day, she says, well, you know, I'm also cutting threads off of clothes at the garment factory. And I said, why do you need to do that? You're 83 years old. And she says, yeah, I make about 25 cents an hour. I swear to God, that's what she said. I said, well, you don't need to do that. She says, I just want to be useful to people. So Mrs. Zhang was a very special patient of mine, because I knew she had not gone to formal education, but she was so resourceful. She thought about bringing her family to the United States and how much she felt about being valuable to other people. So Mrs. Zhang, one time in the evening, the emergency department called me up. Said, Mrs. Zhang, your patient's in the hospital right now. Sounds like she had a GI bleed because she was coughing out coffee grounds. And you know, the first thing I was thinking is like, oh God, I shouldn't have given her the ibuprofen. You know, she's 83 years old. I probably induced her gastritis. I just hope that she can get out of here. I'll schedule then the endoscopy on Monday, and you know, maybe we'll stop the bleeding and everything will be okay. Monday comes. The GI guy calls me up. I think, oh, this gastritis. He says, well, she's got an inoperable lymphoma, gastric lymphoma. So you can imagine, I was really torn and upset. Great lady, 83 years old. I went in Tuesday morning expecting to give her this diagnosis. And I was greeted by about 10 family members who said, Dr. Wong, what's happening? She got the special test yesterday. And I said, well, I think she's got a cancer in her stomach, and I don't think we can operate because of her age and the advanced nature. And I was saying all this in Cantonese. And the family member said to me, Dr. Wong, you can't tell her that she's got a cancer in her stomach. As soon as you tell her that, she's going to give up. There's no reason for her to live. Just don't tell her. Now, I grew up the kid of immigrants, and I understood kind of the karma of talking about death, but I've also been trained as a UCSF medical student. You're supposed to share your knowledge with your patient, be in that shared decision making. But I had to go into this room. What would you have done? Because I don't think this story is going to be so unique. It's when you're torn between what you know is supposed to be done and what your family tells you, their family tells you, and your relationship to your patient. I went into that room not knowing really what I was going to say. I really did it. Mrs. Zhang, she saw me come in, and she says, Dr. Wong, how are you? And I said, you know, I'm okay. And then she says, how are my tests? And then I said, well, they're not so good. And then Mrs. Zhang looked at me, and then she said, Doctor, you've always been a great doctor for me. You've always taken care of me, and I'll be okay. And so she witnessed already my pain. And who was the healer then? Who was the healer then? And she died a few months later. But it's really these patients that are so precious to you that lead you through this journey of what it means to be really a healer, as opposed to being an MD, DO, PT, PA. So think about that. Think about that day that you got that letter and these moments that really should be special to you about caring for the people that you're so privileged to take care of. So thanks for your lunchtime.